Hello, I'm Dr. Bhawna Sirohi. I specialize in treating patients with breast cancer. Breast cancer in India is rising at the rate of 2% per year, and according to the current statistics of the National Cancer Registry in 2020, the incidence of breast cancer in a city like Chennai is 42 per 100,000 population. In a place like Hyderabad is 48 per 100,000, which is the highest in India. Now, the incidence in the West is about 100 per 100,000. So it is still half than the West, but our newly diagnosed patients with breast cancer is rising every year. And I think this is related to a lot of lifestyle factors which are completely in your hands to control. And some of the lifestyle factors that have contributed to increased incidence of breast cancer in urban India or cities is related to late marriages, not being breastfeeding, increase in using processed food or diet, junk food, or a fast lifestyle where we are not exercising, having more of foods which have increased fat content or the saturated fat content. Also, use of alcohol, smoking are also risk factors which are implicated. The incidence in the villages in India is about, I would say, 7 per 100,000. So you would have a city and a village next door, and the incidence is dramatically different. And this, I think, is related to a clean lifestyle in the villages, which could be due to eating fresh food, not having processed food, having an active, healthy lifestyle, and also possibly being stress-free. So what can one do to prevent breast cancer? I have the ABCs of cancer prevention, and I think it fits in very well with breast cancer. A is you avoid smoking, avoid alcohol, avoid the use of or increased use of hormone replacement therapy or oral contraceptive pill. Avoid diet which is rich in fat. B is be aware about your breast, which is very important. Breastfeed if you have children. C is calm. The West is moving towards yoga and meditation, and there are quite a few studies which show that this does help in leading to a stress-free life. D is diet. Have a diet which is varied, rich in fruits and vegetables. The fat content should be low in saturated fats and high in unsaturated fats. Very important that you eat what is fresh and local to your area. E is exercise. There have been studies which have shown that if you exercise regularly, at least 30 minutes per day, the chances of you developing breast cancer goes down by 20 to 40%. F is family history. Know your family history. If you have a relative, a mother, sibling, or your first degree relative on the maternal or paternal side, seek help and take advice. S stands for screening and sleep. So if you are 50 and above, you must undergo a mammogram every couple of years, which has been shown to diagnose cancers early. Sleep is also a very important factor. In fact, there was a study, a large study, population-based in Spain, done which showed that if you slept before 9 p.m. and if you had 2 hours between your last meal and sleep, the likelihood of you developing breast cancer goes down by 25%. So I think very important that you follow this ABC, D, E, F, S of prevention of breast cancer. How do we diagnose breast cancer? We diagnose breast cancer by a triple test, which is a thorough clinical examination by a specialist, age-appropriate imaging, which could be an ultrasound or a mammogram, depending on what age you are, and also a needle biopsy, which helps us diagnose. The treatment of breast cancer over the last few decades has improved remarkably. So even ladies with stage 4 breast cancer can have a normal quality of life. Cancer survivorship is something that I'm passionate about as well. As far as treatment of early breast cancer is concerned, we hardly ever recommend removal of breast or mastectomy in patients nowadays, because there are strategies to shrink the cancer so that breast conservation surgery or oncoplasty or reconstruction is possible, so that you are able to have a normal quality of life. So very important that do not ignore any of these symptoms, like a lump in the breast, or if you have a change in contour of your breast, or the nipple is retracted, or you have a bloody discharge from the nipple, please take help. And very important that you are breast aware and know what is normal for you. So do a clinical breast examination for your own breast at least once a month, and see a specialist once a year for a clinical breast exam. Thank you.